Hi, everyone. Thank you for joining us today for the Rural Drug Addiction Research Center's digital seminar series. This series allows us to learn about RDAR Center researchers, as well as partner researchers and community organizations in the area of rural drug use and addiction. Today's talk will focus broadly on measuring rurality. I have to practice to say that. Hopefully that's correct, Patrick. What we mean by rural and how rural intersects with substance use research. As many of you know, I am one of the co-directors for the Longitudinal Networks Core, or the LNC, and I'm happy to introduce Dr. Patrick Habecker today, who is also going to have a new role and is going to be also co-director of the LNC. So I'm excited and looking forward to working with Patrick in this new role. Today, I'm also happy to introduce Dr. Habecker as our seminar series speaker. His research focuses on substance use and policy, survey research methods, and recruiting hard-to-reach populations. His most recent work has focused on stigma towards people who use drugs and support for different substance policy options. He also works with the RDAR Center at UNL to recruit and work with people who are using drugs in southeastern Nebraska. So again, thank you for joining us, everyone. After Dr. Habecker's presentation, we'll have some time for Q&A, but if you have questions during the presentation and you don't want to forget them, please feel free to use the chat for questions and comments, and we'll keep track of that. So on that note, Patrick, I'm going to go ahead and mute and take it away.
Fantastic. Thanks so much, everybody, for joining us here today. I do apologize for that initial delay. That was entirely my fault. For some reason, my browser window is having a problem connecting to Zoom. So I appreciate your patience and waiting to join us today. So the topic today is really fairly broad, talking about measuring rurality or measuring rural, and going through a couple different measures of that and how it connects to substance use. So get out of that screen. So why rural in the first place? Why is this an issue of topic? Research around health disparities often characterizes differences between rural spaces and urban spaces and access to services such as healthcare providers, employment opportunities, high-speed internet, as well as individual divide, which I think may be more ideological, where, for example, recent media has focused heavily on there's a rural-urban contestation going on in the United States, rural areas versus urban areas. And all the media may think this is somewhat new-ish. This also is tapping into centuries-long power contestations in the US between what we might think of as urban and rural areas. Now, more specific motivation for this talk is that in perhaps one too many internal meetings here at the RDAR Center, I made a comment about measuring rurality and all the different ways to do so. And at some point, someone said, well, you're up for the seminar because of that. And so I'm delighted to be here and talk a little bit about this. The talk itself is going to have four broad pieces to it. The first is I want to walk you through several different schemes to measure rural geographic space. These are established, some of which may be familiar to you, some may be new, and we're going to walk through what they're measuring, how they're doing it, and what some of these classifications look like both here in Nebraska, and also a brief focus on the Mid-Atlantic, just to get a sense of how these things work. At the tail end of that, I'm also going to talk a little bit about if you're interested in using these measures, what type of data do you need, where can you find it, and what are a couple of basic challenges of that, ideally with a survey research focus. Having gone through those, we then want to think about what are these measures missing and what might we add to our work when we're thinking about how we might measure rural. Then shift a little bit to focus on Nebraska and look at how several different substance use related topics and policy issues are related to different rural measurements for this state. This is the center's focus, is to study substance use, particularly in Nebraska, so we're going to switch to that. And then finally discuss a few challenges of rural substance use policy. So let's get started. Measuring rural. As always, there's an XKCD comic for everything. Situation, there's 14 competing standards. 14, this is ridiculous. We need to develop one universal standard. Soon, there's 15 competing standards. I bring this up because there are quite a few different ways that we can measure rurality that exists within the various different federal systems. So we're going to work through a few of them in detail, and we need a couple starting definitions here, and these are all USA specific, right? So one of the core concepts is that there is an urban area. So this is a contiguous area, meaning that they're all abut to each other and to some extent, so there's no gaps or leaps, with at least 50,000 or more people, and that some area within this has a density of 1,000 people per square mile. The next rank down from this is an urban cluster, which is a contiguous area with at least 10,000 or 2,500 people, but less than 50,000 people, with the same requirement for a density. We then also need to be familiar with what a county boundary is. So this is a political boundary of administration that is nested within a state. In a lot of states, this is the third level of administration, where you might think of as a federal government, a state government, and then a county government. And in some states, these are known as different things, such as parishes in Louisiana, or their equivalent in Alaska, for example, is a borough. Finally, within a county itself, we have census tracts. So these are smaller geographic areas within counties that average around 4,000 people, but have hard minimum and maximum values. So census tracts that get below 1,200 people are merged into others, get larger, and census tracts that reach and exceed 8,000 people are broken up into smaller census tracts. So I'm going to go through 4 different measurement schemes here in a little bit of detail. So core-based statistical areas, or CBSAs, combined statistical areas, or CSAs, rural urban continuum codes, or RUCs, and rural urban area commuting codes, or RUCA codes. So let's get started with the core-based statistical area. In some ways, this is one of the most basic one, and also provides you a good place to start for thinking about other ways we can measure this. So CBSAs are classification schemes to identify counties that economically interact with urban areas, right? So remember our definition of that urban area as at least 50,000 people with a certain density attached to this. And core-based statistical areas will define metropolitan areas and micropolitan areas, where those units are counties themselves. So metropolitan CBSAs have a core urban area with at least 50,000 people. This core can be in one or more counties, and the metropolitan area itself can contain counties that you might not necessarily think of as being highly dense or having a lot of people. But if there's a high enough level of residents from a smaller county commuting into a core county, they'd be considered part of the metropolitan CBSA. The next category down is the micropolitan CBSA. These have a core urban cluster with at least 10,000 people, and other counties are included, again, if enough residents commute into the core. All counties that are not in either a metropolitan core or a micropolitan core are thought of as non-core counties. So let's visualize what this looks like. Instead of just staring at screens of text, I'll give you plenty of that as we go through. So this is a toy example where we have sort of a central city here, right? That meets our definition for an urban area of at least 50,000 populations. The dark shading then defines counties that are either directly part of that urban area or have enough commuting into that urban area to be considered part of the metropolitan area itself, right? To define this core metro zone. The areas in the lighter gray shades are then micropolitan areas. These have their own urban cluster at the beginning or in their core. So an urban area between 10,000 and 50,000 people, and then can include either their own county or include other counties as well that are commuting in. So this example in the upper right here is a micropolitan area with one outlying county that has enough commuting into that to be considered as part of the micropolitan core, and the dark gray is your metro. So let's see what this looks like in practice. So here is the CBSA cores for Nebraska based off the 2020 maps. And by the way, if you enjoy maps, the census provides really nice high definition maps of these that you can print out and cover on your wall. So Nebraska contains 4 metropolitan CBSAs. These are the darker green shadings. So we have the Omaha Council Bluffs region over on the right, the Lincoln metropolitan area, the Grand Island metropolitan area, and the Sioux City metropolitan area up in the northeast. So a few things to note here is that these metro areas can really extend past what you might intuitively think of as being the borders of a metro or an urban area. Saunders County, for example, in the Omaha Council Bluffs area, or Harrison County. These are things you might not think of as being intuitively part of Omaha Council Bluffs when you pass through them because of how the terrain changes or how the visual density. And this is where those commuting aspects come through. The second big thing here to notice is how these cross state borders, right? So if you're looking specifically at a state, not all metro or micro core-based areas are defined by state boundaries. They can cross over. They are defined internally with county borders, so you at least have some continuancy with that, but be aware of how these can spread across. Now, the light green here then are our micropolitan areas. So in Nebraska, we can see Fremont, Norfolk, Columbus, Beatrice, Hastings, Kearney, Lexington, North Platte, and Scottsbluff. And you can sort of see how these edge into these other spots. Now, Nebraska is a good example to show a space that is external to the metro micro, and the Mid-Atlantic is a good space to show where it is not. Particularly if you look at sort of the line of cities on the East Coast, so New York, Trenton, Philadelphia, down into Baltimore and DC, you can see essentially every county in this stretch is part of a metropolitan core-based area. And some of these are quite large, right? In fact, under this classification, the entire state of New Jersey is considered to be part of a metropolitan core-based area to some extent. Now, if you're noticing on the map, some of these divisions have sort of these dotted green lines through. This is because once a metropolitan statistical area gets with 2.5 million people or more, they can be subdivided into internal divisions, which are shown this way. You want to sort of look at some of these interactions. So this is how the CBSA works. It's one of the basic classification systems. It builds off of counties. It uniquely identifies separate metro and micro regions. So every metro and micro that's defined will have its own unique identifier, which means that if you have a data file for every county in the United States, you can uniquely pick out the different CBSAs and assign them appropriately. But it provides absolutely no distinction within non-core counties. So if we go back to this Nebraska map, if you are external to a metro or a micro, everything is assumed to be pretty much the same, right? We're defining rurality here as absence of a metro or a micro. Now, one slight variation on a CBSA is what's called a combined statistical area. And I'm not going to get into this one too much, but I want to bring this to your attention because these build on CBSA definitions to identify areas of entanglement between multiple adjacent metro and micro areas. So if you think about the division between a metro and a micro, is this a hard line, or is there a fair bit of inner trafficking between a micro and a metro area? And often this is, again, talked about how much employment is moving across these boundaries, how many people are commuting across in both directions, right? This is still a county-based classification scheme because it's building right off the CBSAs, and it's not really doing anything with the non-core counties. But if you're looking into these types of measurements, it's entirely possible you're going to run into this CSA measurement and have to deal with it and try and think about how to deal with it in your data. So on the left here is the CSA Nebraska for the eastern portion and the CBSA example on your right. And you can see that the Lincoln and Beatrice, which was a metro and a micro area, are a combined statistical area in the CSA scheme. So it's that Lincoln-Beatrice. And the Omaha Council Bluffs metro incorporates Fremont as well to create a larger combined statistical area. But these other areas that are a little further to the west on this map, so the Grand Island metro, the Hastings micro, the Columbus micro, these aren't interconnected enough to be considered their own combined statistical area. So not all metro areas will become part of a CSA, not all micro will, but it is a way to sort of get a little bit more into this entanglement and how things move across. So the big failing of things like the CBSA or the CSA is it just leaves non-metro counties blank. There's no distinction there whatsoever. So the rural-urban continuum codes are a way to try and get at this and get a little bit more delineation about what's happening in these other counties. To do their classifications, they create 9 different categories a county can be in, and it's based off metropolitan status, which is, again, pulling off the CBSA, population size, and then also adjacency. And this is actual, do you share or border with the next county? To get to their 9 different categories, it first starts by splitting counties either into a metro or non-metro county. So this is using that CBSA definition. So any county that was in a metropolitan CBSA gets pushed over into the metro side, and anything that's not is in the non-metro county. Metro counties are then split into 3 groups by population. This lets us see some distinction between those metropolitan counties themselves. Does this county have 1 million or more people, 250,000 to 1 million, or fewer than 250,000? And this can get quite low, but remember the threshold here first is it in a metropolitan CBSA? And then what is the population within? So we then get 6 non-metro county classifications. And these are based first off population splits and then adjacency to metro counties. So a classification of 4 would be 20,000 people and that county, or sorry, 20,000 or more people, and that county is adjacent to a metro county, where a classification 5 would be 20,000 or more people, but it's not adjacent to a metro county, right? So the idea here is that this adjacency is capturing some of the commuting entanglement that we see from the core-based statistical areas and CSA codes, right? We then have a next category that looks at counties with 2,500 to 19,999 people, and whether they're adjacent or not adjacent to metro counties. And then for counties with less than 2,500 people. So your CBSA micro core counties fall anywhere between categories 4 to 7, right? Because if you remember, CBSA micro counties have at least 10,000 people. And so they could fall into 2 different population thresholds and then based around their adjacency things. Now, the advantage of the RUCC Continuum codes is we get a lot more information and a lot more detail about these non-metro counties and what they're characterized as and what they sort of look at. So I do apologize, it was really, really hard to find a high resolution map of the RUCC Continuum codes. And the most recent version is from 2013. These are due for updates in 2023 as sort of the 2020 census stuff rolls through, and then we start doing all the updates to these county classification systems. So we can see here, the super bright green is 1 million or more metro, and as it drifts towards red, we're getting into some of the smaller categories. And again, apologies for the resolution, but if we think over here on the right, what does Nebraska look like? Whereas before with the CBSAs or the CSA codes, we had pockets of here are our CSA counties, or here are our metro counties, and then here is nothing, right? We now get to see some distinction between these smaller counties, and the counties that have smaller populations that have more distance between them and metro counties versus being directly adjacent to them. This also gives us a little bit of a break in New Jersey. I'm going to come back to Jersey a couple times here just because New Jersey is just so completely in metropolitan CBSA cores. And you can see, and again, you gotta kind of squint, but some of these counties are starting to shift in their metro classifications, right? Due to the population sizes within it. So if we were, for example, using CBSA cores to understand patterns in Jersey, everybody would have the same code. We could identify different metros. But within that, we would lose sort of all of the variance of what individual counties sort of look like. And with the RUCC maps can get us a little bit closer to that. So if you want to use RUCC codes, you still need county data. It does split metro counties by population size, so we get a little bit of variation within that. The micro classifications are around, but they're mixed into the non-metro counties in a way that would be actually kind of hard to pull them back out to get to the micro CBSAs. And for non-metro counties, we lose measures of commuting to catch entanglement and economic entanglement, but instead we have geographic adjacency. Now this isn't always equivalent, and so some counties that are not micro in the CBSA might be lifted into higher categories in the RUCC, and some that might be micro in the CBSA might fall depending on physical locations and population sizes. And a big chunk of that comes from the different population breaks that the RUCC uses compared to the CBSA micro. So with the less than 2,000, counties with less than 2,500 people, the 2.5 to 19, and the 20 plus, whereas the CBSA micro cut at 10,000. So moving along, unlike the previous three, the rural urban commuting areas build on a very different basic block. Right? So previously we've dealt entirely with counties as our basic building block. The RUCC is built instead on census tracts. So census tracts are nested within counties. So they're smaller units. They have a finer level of detail for differences between different categories. They also have the advantage of, like counties, being able to be matched with a huge amount of census data, as well as any other survey process that logs or notes census tracts. So it's easy to append a bunch of data onto what you're doing. RUCA codes also build on the metro and micro CBSA classifications, but we're now just operating on a smaller level. And so what we can do is to have a much more detailed split based off not just population density, but also on commuting levels. So the RUCA codes give us actually 31 different classifications we can apply to different census tracts. There's 10 primary codes that look at basically the largest commuting flows in the tract, and then 21 secondary codes that let us categorize census tracts into sort of secondary areas of commuting. And I'll get into that in a second. So the primary codes, your top 10, focus on 3 types of cores and the largest commuting flows from a tract. So cores here are clusters of tracts, and tracts are part of the core if 30% or more of that tract's population is in the core, right? So we can have a cluster of tracts that define a metro core, which is 50,000 or more people. And then a code 2 is then a metro area, so it still has our population density requirement, but has a high level of commuting. 30% or more of the people that live in that tract commute to a metro core. Level 3 is a metro area low commuting, so same density requirements, but the primary commuter flow is 10 to 30% to a metro. And then we repeat this for 2 different types of cores. So we can have a micro core of 10 to 50,000 people and a small town core of 2,500 to just under 10,000 people. And this lets us distinguish how census tracts interact with each other and get a much finer detail of where we might draw lines between what we consider rural and have more shades in between to say what could be rural versus what is urban. So we have our 10 primary codes and then the 21 secondaries track secondary, or where the second largest commuting flow is. So if you have track 1 and 40% is going into urban area 1, but there's also about 20 or 30% of people who live in this tract that go to a different urban area. This lets us track that and say, to what extent are tracks being drawn in multiple directions or just really commuting into one central core? Now in practice, 31 codes are a lot of information. So in practice, you're probably going to condense a lot of these down to fit your purposes. So let's take a couple examples. So these maps come from the University of Washington. They're a little dated, they're using 2005 RUCA definitions, but I really like them. And so I'm stepping back slightly to this. So here's Nebraska with the RUCA cores, and they're using a 7 category classification of those 31 possible categories to create urbanized areas, other urban areas, large rural cores, other large rural, small rural core, other small rural, and isolated rural. And I've contrasted this with our CBSA map over here on the right, and then below it, our very poor definition RUCC map. And there's quite a few things that pop out to me when I'm looking at this. And one is in the urban section. So if you look at the Metro CBSAs for Omaha, Council Bluffs, or for Lincoln, you can much clearer see where the edge of what we might think visually or intuitively when we're driving through these areas is the edge of an urban area. Where does Omaha City end? Where does Lincoln City end? Where does it start to feel or look like something different? Right? While still managing to catch, these are areas that are connected to these other urban areas. So what's shown in gray here, right? And this also shows really nicely in other parts of the state, right? So we get a lot more detail about these micropolitan areas as well as overflow, right? Because we're no longer restricted to counties. You can see how these smaller micropolitan or smaller towns are really connected to other tracts around them to sort of calculate almost really sort of zones of influence. How are people connected to each other in this area? Or how are tracts connected to each other? This also shows up even when we look at New Jersey. So again, the CBSA here for New Jersey over on the right is entirely a metropolitan CBSA, several of them, but they're all coded the same if you were looking at county codes. But if you look at the RUCA maps, we see a fair bit of variation here. And in fact, we see huge chunks of urbanized area, other urban area, but we even see large rural cores and other large rural areas nested within New Jersey, right? So these are sections that would be completely lost if we were using that larger CBSA classification. And instead, by shifting to the smaller one that's also more sensitive to local context, we can get a better sense of what these things look like. So a few other schemes in brief, to be honest, I know this is a lot. One is the urban influence codes. This is again a county-based system, provides 12 categories, and again builds off the CBSA Metro Micro, but also sorts counties by population and adjacency. So it's somewhere between a CBSA and a RUCC. It's honestly much closer to a RUCC than a CBSA. And also county typology codes, right? So these are again county-based, compares metro to non-metro counties, but also sorts counties based off their economic specialization. So is this a county that specializes in agriculture, mining, manufacturer, federal state government employment, recreation, or non-specialized. And if you pull this data set that classifies these counties for the county typology codes, you'll also get other county classifications such as measures of persistent poverty, persistent population loss, and a handful of other things as well that are sort of prepared for you that you can fold into your own data. So for example, from the county typology examples, on the left here, we can see the split between metro and non-metro counties. And then to the extent to which a county can be thought of as farming dependent, meaning that 25% or more of the county's average labor and earnings are derived from farming, right? Where 16% of the jobs are in farming. Now on the right, we can see population counties from 2015, right? So these are counties where the number of county residents has declined in 2 successive censuses, right? Censuses. 1990 to 2000, this county experienced a loss, and then from 2000 to 2010, it also experienced a loss. This is another place where we'll see updates once the 2020 numbers roll all the way through all the different measurement cycles. So this can be a useful way to try and characterize counties, not necessarily by population density, but changes in population, as well as focus on different types of agricultural or industry standards. Whew, need a moment. So before we get into the next section, I want to take a brief moment to think about how we can use these schemes with survey data. Because for a lot of us, we might have data or we're interested in data, or we're going to collect data, and you say, hey, this is really cool. I want to incorporate this into my analysis. And so I want to briefly talk about what you need to look for and what you need to do these. Most of these data sets or schemes require county data, with the exception being the RUCA that needs census tracts, right? So if you're dealing with secondary data, if you didn't collect this on your own, you need to go into your data file and try and find ideally what is called a FIPS variable, or it might just be labeled as a state and county ID. If it's FIPS, it's a 5-digit value where the first 2 digits identify the state and the last 3 identify the county. So for example, the county I'm sitting in right now is in Lancaster County in Nebraska, and the FIPS code for this is 31109. The 31 that leads identifies the state. The 109 that identifies the county itself, because after all, there's different Lancaster counties in different states. And there's also different states that might use the same county ID as 109. So you need them both. Census tract is another abstraction below that. Remember, census tracts are nested within counties, and it has a 6-digit value, but depending on who codes it, you might have some preceding digits missing. So the census tract I'm in right now is census tract 6, which might be shown as 000600 or 0006.00 or just 6, depending on who did the work. Sometimes if your data has this nicely done, you might have a variable that combines state, county, and the tract ID as well. So that would look like what I have here in the lower left, 31 for the state, 109 for the county, then 00600 for the tract ID. So if you have these things in your data, you're good. You can apply any of the schemes that we've talked about here. It's just a matter of applying the recoding values to these variables and moving on. However, you might not be that lucky. You might not have a FIPS or tract IDs, particularly maybe not the tract ID, but you might have a zip code, right? And a zip code, if it's the only thing you have, is less than ideal, but can still work. And the big problem is that zip codes can cross over state, county, and tract borders. So you might have a single zip code that's in 2 counties, but you don't know which or what parts are in which part of the county, right? And this is because zip codes aren't necessarily what we might think of as shapes. Instead, they are routes, lines, points, and they're not the same type, nor do they adhere to the same shapes that we use for political boundaries like counties, tracts, and states. Now, if you only have zips and you need to try and make it work, there are solutions for it. It's going to be imperfect for some cases. And basically what you're looking for here are crosswalk files that describe the proportion of addresses in a zip code that are in various other units. So the U.S. Department of Housing and Urban Development updates these quarterly. You can grab them at this spot. And this is what they look like. So I have an example. The top one here is a zip to a county, and the bottom one is zip to a tract. So zip code 68588. Which is where I am, and county is in county 31109 completely, right? So as we move across this gray box here, we get told what proportion of residential units are in this tract, or sorry, in this county. Zip code. What proportion of business, proportion of other, and which proportion of ratio. So this is saying that 100% of the business addresses that are in the zip code 68588 are in this county. 100% of the others, and really the total, all of them are all in this one county. That's a very easy split to do. It's a 1-to-1 match. However, this zip code that's right below it, 68601, is split across 4 different counties here, into county 141, 037, 023, and 143. And here, depending on what you're doing and what your data looks like, we can see that 95%, right, 95.8% of residential addresses in this zip code are in this county, right? So it sort of sums as you come down, as well as most of the business addresses and most of the other. And in fact, 96% of all the addresses in zip code 68601 are in this same county. So what you can do is trying to say, okay, if I've got 100 addresses that are in the zip code, maybe I can just sort of multiply this out and allocate them into the county this way. It's imprecise, it's fuzzy, but it's sort of where you're left. The only thing you have zip and you really want to get a county out of it. Tracks are even worse because you're rarely going to find a one-to-one allocation between a zip and a tract. So our previously very nice zip code of 68588 that went into one county is split across 6 different tracts, right? And our 68601 zip code is split across 10 tracts. And for all of these, you have to make distinctions and comments and think about how you're going to split these across. Now, if you're doing your own data collection, you can ask, or you can look for sources for this yourself. If you're fortunate to be using address-based samples, you can get FIPS and census tract IDs from the sampling frame itself. If you're not sure where to look, talk to whoever you're buying the frame from. They should have it available for you. But if you're using other sampling frames, such as phone, online, or venue, this information may not be on the frame and you have to ask it directly. Unfortunately, it's super unlikely that a survey respondent is going to know their FIPS or track ID. I don't, and I'm giving this talk. I do not know what my FIPS or track ID is, aside from if I try and remember it from 4 pages back. But they will likely know their county name, which you can then translate into a FIPS code, and their zip code, which if you really wanted to try and get down to tracks, you could try. Whether they will tell you depends on the context of the survey and how much they trust you, because you are getting close to where do you live, particularly with zip codes. But if you really want them to provide you with a tract ID, you likely need to take several extra steps to give them a way to look it up or ways to make it really, really easy for them to do so. All right, so this is a lot of government standard ideas about how we measure virality. And I'm a little curious here what your impression of these measures are. Do they find virality to you? And what this sort of looks like, you know, and feel free to drop this into the chat. I'm just opening the chat myself. Whoever had the comment about living in State College and Center County is rural, I agree with you. I lived in State College for a little while. I was always a little surprised at that marker. And yeah, we can pass the slides out afterwards, right? So I'm going to drink a drink and see if anyone posts a question into this. In the interest of time, okay. Yeah, this is much more urban in Nebraska, maybe less, yeah. So let me think a little bit about how I think about these and sort of where we go from them. Is that I think a lot of these measurements, yeah, are getting at space and not necessarily identity. Right. So a question, comment from Kathleen Bogan: how do we measure perception of virality? Or subjective measures of reality, which may benefit social science researchers, and I agree 100%. Right. And that is that all of these spaces are defining geographic spaces, right? And we're sort of also assuming homogeneous populations within, right? And as you went through these are all built off a basic idea that density and population size is what is a defining characteristic of to being not rural, right? To be urban, right? And sort of what's left over for a lot of these things is that rural becomes defined as the remainder. What's left over? It's the space that is not urban, not dense, not interconnected, without a coherent definition. It is, you can think of it almost as being defined as the lack thereof by these different categorizations, right? These measures also lack, to me, individual history. You know, once you move across a political border or across these classifications, you are now a metro, a micro, a non-core person just by moving across this, right? So it has no history to it. And for a lot of our outcomes that we're interested in, whether it's political behavior, health history, or health futures, these things might matter a lot. Where did you grow up? What was the kind of place that you would grow up? But it also misses individual perceptions of where they live. You know, how do people think about where they live within this larger scale geographic conceptions, right? Or how do they even describe themselves? You know, do you think of yourself as a rural person? And what does it mean to you to think that, right? So I don't have perfect answers to this. I can only tell you a little bit about what we're trying to do here with a couple individual questions to try and answer this a bit better and to get a better sense of this, what this might look like. So I can't necessarily share results with you, but I can tell you what we're looking at, right? And so two aspects of this is this perceived place, right? How do you think about the place you live? And how do you think about it currently? And how did you think about it where you were growing up? How did you define this place? And then how do you think about yourself as a rural and urban person? And so what these look like is, for the current, how would you describe the community where you currently live? Is it a city, suburb, small town, or a rural area? And then how would you describe the community where you spent the majority of the time when you were growing up, right? Is it a city, a suburb, a small town, or a rural area? And this latter one is adapted from a Pew Research Center question that they asked. And then we sort of also used it for the present tense to try and get this sense of not just where do you think you are now, but where do you think about where you grew up? And how do you think that shaped attitudes, ideas, experiences? The other piece, though, is identity. And so a lot of times when I'm reading articles that talk about rural identity, they're sort of coming after this first one here, right? So how would you describe the community where you live? What is your perceived place? But I think there's also a useful thing to sort of explore. How do we think about this as a person? How do we think about this as our identity as a rural or urban person? And so this is entirely spun out of our own shop. So the idea was, well, you can think of yourself as being completely rural or not at all rural. And we also think about the term country as being folded into this a little bit. So one question asks, how much do you think of yourself as a country or rural person? And then separate, how much do you think of yourself as a city or urban person, going from not at all to completely? And the goal here is to really to allow participants to move on both axes, right? So someone could conceivably say, I think of myself at high levels of both of these. And it'll be up to us to sort of see what these look like. This is exploratory for us to think about what is identity, how does it move through? So small steps, but trying to think about what we miss from a lot of these larger geographic spatial areas, right? And so moving on to sort of this next step here, and for what some of you may have tuned in for the entirety of it, thinking a little bit about drugs and rurality. And so what I want to look here is to look at some of the spatial measures we covered in the beginning, and a couple of Nebraska areas that look at a range of policy and sort of access stuff, right? And so why motivate rurality and substance? I think maybe not for the crowd that's attending this, but I think it's really easy for people to assume that substance use is an exclusively urban or a largely urban phenomenon, even though historically this hasn't been the case. But there are different patterns and trends that exist and tend to catch the public's eye in different ways. There's also very large structural impediments, right? So the same problems that deal with access to healthcare, access to broadband, can run into problems with access to treatment. You know, if there's only one type of treatment available within a 3-hour drive, you better hope that works for what you need, or maybe you'll try on your own. Also, access to harm reduction models. These are increasingly being deployed, and to what extent are they going to reach more rural areas? Or are they just going to get dropped in an urban area and basically be left to fend on their own to translate into rural spaces? Or do they even work well in a rural space? So a couple different outcomes I want to move through, and I am trying to be cognizant of time, so we may cut a little bit here. And I apologize if this is the meat of what you were after. I'm totally happy to stick around afterwards. So what I'm going to use here is some data that we collected in 2021. This is an address-based survey of Nebraskans. It was fielded through the summer into the fall. Nebraska, by the way, if you don't know, age of majority, you have to be 19 or older. And this was an address sample of 8,000 addresses. We had 21% response rate, pretty decent. And the estimates you're going to see here are weighted for sample design, within household selection, non-response, and 3 population characteristics of age, sex, and region. So when one of the questions we asked them was, do you know anybody who's experienced a drug overdose in the past year? As we know, drug overdoses continue to climb. And even though Nebraska is a state with a small number of overdose deaths total, it is increasing at a fairly high rate. Year over, we were just 32% increase over the past year as part of that countrywide bump in the last few years. And we know that this can, sorry, saw the chat. We know this can lead to vicarious trauma. This can lead to experiences like if it's direct, or even just knowing about this can change attitudes about politics towards substance use, politics towards harm reduction, and even your own actions, right? So a basic question here is, to what extent are people in Nebraska have differential exposure to drug overdoses in the past year? They know somebody who has experienced this. And what we're using here is two different ways to measure this. One is the rural urban continuum codes, but this has been cut down into 5 out of the 9. So we have our 2 metro counties. Classification is 250,000 to 1 million. This, by the way, is because there is no metro county in Nebraska with 1 million or more people in it. The metro of less than 250,000, and 3 metro classifications purely on population. So 20,000 or more, 2,500 to 19, and less than 2,000. And then I have the CBSA cores here, right? So whether the person was in a metropolitan, micropolitan, or a non-core. So we see here, as far as estimating the proportion of people that have experienced a drug overdose, or who knowing someone who's experienced a drug overdose, is fairly universal. There's some variance in the confidence intervals, but our means are very similar, all between 6 to 7%, with some extensions around those CIs, with some of them getting up into 11, 10%, depending on what it is. So when you're thinking about how do we need to talk to people who may have experienced this or know someone who's experienced their information that needs to be experienced in a Nebraska piece, then this is something that we need to think about statewide and not just focused on Omaha or Lincoln. A big chunk also in combating overdose deaths has been to deploy Narcan and to increase awareness of Narcan and naloxone sort of universally, right? So we asked the question, do you know where to get Narcan and naloxone if you need it? And participants could say yes, no, or I don't know what this is. And here we do see some interesting differences, such that people that lived in metros of 250,000 or more, and so that's Lincoln or Omaha in this state, about 20% knew what it was and knew where to get it, right? But if we look at particularly this percent of people who didn't know what Narcan was in the first place, we can see that we're approaching 50% in a lot of the non-metro counties, right? 41%, 43%. And even the smaller metro counties with less than 250% are looking quite different from that metro with 250. And this is fairly similar as well with our metro to micro and non-core, right? The micro and non-core here look similar-ish. Particularly with the I don't know what Narcan even is, much less know how to get it. But we do see with metropolitans, people in a metropolitan core, that there's more people know what it is and more people know how to get it. Sorry, I clicked on the wrong thing. Another sort of interesting concept here to think about is access to substances. So could you get these things if you wanted to? Without prescriptions, yes or no? And we asked about a range of different things to talk about, right? And I do apologize if your eyes are crossing over a little bit of all of the numbers. It's just one of the simpler ways to do this and keep the confidence intervals intact without people just looking right at the means. So if we look at access to marijuana and cannabis, 46% for our metros, but with pretty narrow CIs. And as we get down, a lot of these are in similar bands, right? We don't see huge differences in sort of access to this, both at the RUCC and the CBSAs. Sometimes, so for example, with cocaine, we can see the non-metro county with less than 2,500 people in it has much lower predicted proportion of knowing or saying that they could get cocaine if they wanted to. Same thing a little bit with methamphetamine, but a lot of these other core, rural or core-based areas are in line with each other. We don't see a lot of difference here as far as being able to access. This doesn't necessarily translate into use, but it's sort of the potential. Are these things available? Now, for those of you who aren't familiar, syringe service programs are illegal in Nebraska. So one of the things we were looking for is To what extent do they think it's legal for Nebraskans to distribute sterile syringes or needles for the prevention of the spread of infectious disease? And here we do see some differences as well, where our larger metro counties have a higher proportion of those agreeing that this should be legal, whereas those in the smaller metro counties are smaller proportions and are more likely to disagree. But again, keep your eye on the confidence intervals here. There's probably less difference here than might meet the eye. We're also a state where it is illegal to use marijuana medically or recreationally. And we find pretty consistently, this is the second year in a row, that metro areas look different as far as their support for recreational use, as well as when we look at changes in our non-metro counties, more likely to say it shouldn't be legal at all, or that it should be legal only for medical use, whereas support for recreational is more focused in the metro areas. This question, by the way, is adapted from the Pew Research Center's American Trends panel. And you can find a couple updates on this from their national sample and compare how this looks. Another really key piece to thinking about substance use policy is stigma, right? So how do people think about people who use drugs? This can drive attitudes and behaviors towards gain acceptance to policies like certain service programs, or other harm reduction policies, or changing criminalization status of different substances, right? So we asked a couple questions about perceived community stigma. And so these are sets of 4 questions. So most people in my community believe that a person who uses a given substance or cluster of substance, 1, cannot be trusted, 2, is dangerous, 3, to blame for their own problems, and 4, is lazy. In some prior work, we found that this is strongly associated with support for legal or medical and recreational marijuana. And so one of the things we're always sort of curious about is how does this vary across rural urban divides? And we have 3 different stigma scales here, one focused on people who use marijuana, people who use opioids, and people who use cocaine, meth, or heroin, just to try and sort of split out some of these specific substances, right? And different sort of stereotypes that people might think about or carry about people who use specific types of substances. And a lot of the times here, we don't see huge differences across our urban-rural characteristics. For marijuana, we do. So the metro and metropolitan cores have lower mean scores on this. Lower means you are more likely to strongly disagree with stigmatized statements, and higher scores you're more likely to agree with it, that you embrace that stigmatization, right? But for a lot of these, we don't see big jumps around between them. Now let's see, what time do we have? This is where me starting late and having technical problems is going to be an issue. So I want to switch data systems very briefly. So the treatment episode data set logs admissions into different treatment centers. And in some years, they will let you look at admissions by core-based statistical areas. So you can look at metro, micro, and if the county is outside. And so this is the percent of admissions listing different drugs at primary substance in Nebraska to these treatment centers in 2017. And we can see that there are some differences, particularly in some of the more prominent substances that are coming in Nebraska, right? So lower levels of primary alcohol use in the micro areas, higher levels of marijuana and higher levels of methamphetamine as a primary substance in micro. But in the outside, it's still a higher level of alcohol as well as higher levels of methamphetamine compared to the metro CBSAs. Also note here that if we look at the total number of cases, just over half of all cases are in metro. And I want to flip that for a moment. And that means that just under half of all treatment admissions in 2017 were outside of metropolitan areas, where services are clustered, where they're easier to access. And then this is the same thing, but then applied to a rate of per 100,000. And so you can see that these micropolitan CBSAs and even the outside CBSAs, so for methamphetamine, have double to triple the rates of admissions for methamphetamine, double to triple rates for marijuana, and for the outside, almost double the rates of alcohol admissions compared to metropolitan CBSAs. So we can expect some different treatment profiles and different treatment needs, which is unfortunate in some ways, because if we look at the SAMHSA treatment locator for substance use services in Nebraska, you can see they're heavily clustered in the metro areas, Omaha, Lincoln, and in some of the micro areas. But there's some pretty large swaths of the state where if you want to physically get into one of these substance use service centers, you have a bit of a haul. right? And we know that any type of distance traveled is going to make this more problematic, more difficult to get to. In particular, if you need something like buprenorphine, which has even fewer services provided in the state. So I've gone over a little bit more than I maybe have intended, but I just want to sort of have a couple concluding thoughts here while I wrap up, and then sort of see what you all think, and I'm going to catch up on the comments. So a lot of our basic typical measures of reality are really measures of density, right? And they're geographic based, right? And we assume that places that are not dense are rural by definition, right? It is defined by the absence. But these spaces don't catch individual perceptions, identity, or history. And they also sort of assume that everybody within the same space is experiencing things the same way. And we can do things differently to try and bring this out and to play this into, get more nuance out of our data, right? Instead of just going with some of these larger aggregate categories. And I do think there are places where this will intersect with policy. So preventing overdose deaths, thinking about availability of Narcan, thinking about some of our models of preventing overdose death, facilitating treatment. How far do you have to go to get treatment? How far do you have to go to access buprenorphine or methadone? And structural problems such as like distance, availability of clinics, willingness of places to distribute or manage telehealth and remote options are going to continue to worsen as the population shifts in the future. You saw from that earlier map, population changes over the past 20 years that Nebraska, a huge amount of Nebraska counties have continually lost population. And as that population density gets worse, the economies of scale that support a lot of the services that we see in urban areas will continue to erode and vanish and make this a more difficult thing to manage. So that was a lot. And I'd like to get sort of work through comments and sort of see what people think and where we're at. I appreciate your time for coming out. I'm not sure what you had hoped, but I hope at least you got something interesting out of this, or hopefully something interesting to think about today while we worked through this.